Thank you. Hello, everyone. My name's Claire Smith. I'm the Chief Operating Officer and Deputy Chief Exec. Phil normally does this religiously, actually, on a Friday, but he's unable to today. It's Helen Christodoulidy's last day, and she's worked for this organisation for years and years and years. Many of you will know her. So he's at just making a leaving presentation to us. So it's certainly very important to him to be able to do that. So report out agenda. So we've got two teams reporting out today. First one about improving the leanness of quality assurance team by using direct observations, and then we've got using LIM to deliver our financial plan. I think we'll all be sitting at the edge of our seats for that one, because that is a challenge for everybody. And we've had the waste reduction conference this week as well, we heard a lot about the use of LIM in that conference as well. So we'll take questions at the end. So we'll go from one presentation to another, and then we'll take questions at the end. So if we could ask you to start, Sally, is it you that's taking us through this one?
Yeah, it is. So
Brilliant.
my name's, oh yeah, I'll fire away. So my name's Sally. I'm the Performance Quality Assurance and Governance Manager for Estates and Facilities. And I did my LIM project on the QA team. So for those of you that don't know the QA team, they monitor the cleanliness of the wards in the public areas, and they also monitor contractual services such as things like pest control, retail catering, sanny bins, to name a few of the delights of their job. So they award the star ratings on the wards that you might see as you're walking around, and they're probably the most unliked team in the hospital. So I get to manage those guys. So next slide, please. The problem and challenge that I kind of identified when I first took on the role, which was 2 years ago, and I was external to the trust. So I did notice two things. So one was that there's a lot of time waste within the team in terms of travel and efficiencies. So they spent a lot of time travelling between sites and returning back to the office for end of day catch-ups. And then also the way that the cleaning audits were being done was changing to the new national standards of cleanliness, which were in 2021. They came in November 21. So the contractual audits are kind of taking a back seat. So when I took the role of managing the team on in 2021, they were completing about 3 cleaning audits per day per person, and there's a team of 5 with a manager. And they were spending whole days dedicated to auditing contractual services. And those contract audits, they took a back seat if there was any sort of sickness or annual leave in the team. So those were the issues. So next slide, please. So after doing the LIM Foundation in 2022, the time waste was actually reduced by the team. We got an office in the LGI. Well, it was a bit of a store cupboard that we converted into an office, and we put 2 PCs in there. So the team had a base at the LGI and a base at Jimmy's. And then we also got them a joint laptop for when they were at the peripherals. And that we worked out that saved about an hour a day on travelling across sites, getting the shuttle bus to and from. And if it was nice, they might take a stroll over there, like they'd walk there instead of getting the bus. So that saved about an hour a day. And then obviously now they've had the rollout of trust laptops. So they've all got their own laptop now, which means that they can start and finish their audits, whatever site they're at. So then during the LIM intermediate course, which I started in January, we did some leader standard work and Genba observations. They were used to map the team's work, and we calculated how much time was spent on each audit, including the admin and contingency times. And we also changed the way they did the contract audits. So we would tag them on the end of a cleaning audit. So if they're going to a ward to do a cleaning audit, they'd do some sanny bins and pest control boxes at the same time, rather than spending a full day doing them. So that reduced waste again, travel waste and time waste. And then the team also really engaged in the process we did the leader standard work with them, and they all agreed collaboratively how much time they'd spend on each of these contractual audits. And we allow an hour per cleaning audit as well. And they're showing this productivity in the monthly one-to-ones as well, which motivates them. Next slide, please. So this is just an example of the work that we did. It's probably looking pretty small, but on the left is the leader standard work, where we took every single audit that they did and we worked out the time that they used for each audit, and we put that into a monthly, weekly kind of table. And then on the right is the monthly performance document, which I go through with the team leader, and then he takes his team through it. So we've got like a percentage of productivity of how they're working as well. And then we'll look back on it the following month to see if they achieved that or not. And it's really helped with the engagement of the team. Next slide, please. I feel like I'm flying through this, so apologies. The outcome, it's a bit small as well. You can see from, well, I picked up the team in June 2021, but they're averaging about 226 cleaning audits a month. And now there's about 311 audits done per month, cleaning audits. And then if you look at the bottom right-hand side, the bottom graph, that's the contractual audits. It's tiny, but the contract audits have increased from the full year of 2021, have gone up by 250% from 2021. So it's like a combination of LIM Foundation and LIM Intermediate there. And also the team's working well with the contract manager and the contract assistant manager, and the challenging the KPIs, and also we're working hopefully on some WRP with that off the back of the KPIs that they're auditing. Next slide, please. So what went well? So I'd already kind of started the LIM process of reducing the waste in the foundation at the start of 2022. We introduced a communal laptop so that they could work from the peripherals. I said that already that it engaged the team when we did the Genba walks, and we collaborated on the leader standard work. I'm also running alongside a change management project alongside the LIM project. So the team manager, he had like historical shift patterns. He used to be a facilities manager, so he'd work every other weekend. So we change managed him. So he's now working Monday to Friday. And the team are feeling really well supported because the line manager's present at the same time as them. He's also in turn more engaged because he's doing his leadership development, and yeah, I've got team buy-in, and they feel more empowered, and they've got lots of ideas, and they're going to the contract manager themselves rather than coming through me. So yeah, we've got a happy team. Next slide, please. I guess I would have tried to start the process earlier, but as I said earlier, I was external to the trust, so it was all new to me as well. And I could have tried to start the change management process earlier rather than starting it in January. I said there's always room for improvement, so it's a continual process and work in progress. And then I did the leader standard work on my own time, and it shocked me how much time we've got in meetings and stuff. So I've learned to do a bit of delegation. And then hopefully we're going to do the same process. I've got a data analyst in my team. I just want to understand his workload and put in a contingency plan for him because he's a one-man band. And that's it. That's my project finished. Thank you.
Thanks ever so much. There's a lot in there, and I've got at least one question for you. So I'm imagining other people do as well. So really well done. Thank you for that. Okay, we're going to move on to the next one, which is using LIM to deliver our financial plan. So we've got Ashley and Ruby, I hope, on the call.
Yeah, I'm starting off for us.
Lovely. There you go. There you go.
Thank you. Thanks. So myself and Ash worked together on our LIM project. We were hoping to use LIM to streamline our recruitment processes for our nursing cohort recruitment. And we tried to link that back into our financial plan and improving staff retention. Next slide, please. So these are some of the main problems that we identified. So the first one on there is team capacity. So just for some context, on the in the circle there on the bottom corner, these are just some figures relating to this particular team. So over 2,000 candidates passed through this team between August 22 and July 23, and over 1,500 of those were new to the trust. We also found that the processes that this team were following were quite dated and they hadn't been reviewed for quite some time. We were receiving a lot of advert request forms from the department, so that again was like linking back into the team capacity issues. And these problems were all impacting on the candidate experience. So the lack of team capacity meant that sometimes our candidates weren't necessarily getting the time that they needed from the team, and this potentially led to longer turnaround times in terms of getting candidates clear to start work. Next slide, please. So we started with process review meetings, so the whole team was invited to these. And like I mentioned before, we'd not actually reviewed the processes for quite some time. So in those meetings when everyone was together, we decided to start process mapping, which we found really useful because it just gave us a sort of visual and allowed us to see sort of potential elements that could just be removed entirely. We also work closely with our stakeholders. So that was mainly the nursing workforce team up in corporate nursing. So we put in weekly meetings with those just to iron out and align the processes of both the teams. We also looked at the 7 wastes. So one of the main ones that we identified fell under the motion category. So previously we used to work at an external site called The Shine up in Hare Hills. So a couple of members of the team would spend 2 days a week up at that site. So we decided to sort of just stop that because we felt that it was a waste under motion, like the travelling back and forth between the sites. And also the Shine wasn't fully equipped with everything that we needed. So for example, for us to have our pre-employment check appointments up there, we had to transport equipment back and forth with us, which was another waste under transportation. And finally, we introduced a sit rep that is shared between us in resourcing and the nursing workforce team. And this just helps us to ensure that both teams are on the same page, and it saved a sort of multiple emails back and forth between the 2 teams as well. And I think the next slide is Ash next, I think. Yeah, thank you.
Yes, thank you. I will take over now. So here are some of the outcomes. It was all around increasing efficiency in order, time is waste, so increase efficiency to add value added work in terms of the recruitment process. So we increased productivity for the team, helped deliver our resourcing financial plan. So we were getting candidates cleared on average of 3 days less between June and August 23 to the same period the year before. We're hoping that will continue, as the changes we've made wouldn't have had the full effect by that point. Obviously some candidates might have already been in the process before we started making changes. And then reduction in vacancy rates as well. This table is looking specifically at healthcare support workers and their vacancy rates. So as you can see, that has come down to 14.6% in June 23, compared to 35% in November 22. And since we received that graph chart, there was 130 more healthcare support workers that have started in the trust as well. So we should see that vacancy rate come even further down when we get the next table, probably later on this month. Next slide, please. So what went well? Well, firstly, I've worked in plenty of different organisations before, and in this trust, we felt empowered to make changes, which is really important. And there's plenty of encouragement and support there to do so. The senior team within resourcing are really trying to create a culture of innovation as well. So having their support and hopefully trying to widen that culture and help it grow within the department, that as well is really pleasing. One thing that went well is the team are actually much more open to change than we'd realised or expected. I think I don't know, I did anyway. I just assumed that people wouldn't like change, but actually when you sit down and talk to people, I think they're open to it and they just want to be included. We have been able to modernise and streamline our recruitment process, removing unnecessary steps with minimal risk. So the biggest example, is we were trialling a new more relaxed referencing system within the cohort hub team, and that has what ultimately has helped us reduce that time to hire, if you like. Improved collaborative working. I think the relationships between ourselves and nursing workforce have just grown massively. We've got a real collaboration there, and that just makes day-to-day work so much easier and leaner as well. And then team morale. Our team morale's improved. We're hoping that will increase staff retention within resourcing, but also by reducing those vacancy rates, we're hoping that has some impact on staff retention out there in the wards, as people, feel more supported and there's less pressure through more staff. Next slide, please. And then finally, what would we do differently? Is it complete? No improvement is ever complete, so there are still plenty of things ongoing. One lesson we've learned is to consult the team a little bit earlier than we did on change. Like I said, they were more receptive than we expected, so we could have maybe included them a little bit earlier. Things ongoing, so looking for new releases and new functions on NHS jobs, new guidance, employment guidance on NHS employers, which might mean we have to change things. Process review meetings are still ongoing, and we're still thinking about our team structure, whether it's the right fit, can we change things, etc. And then next steps, things to still work on, continue working with nursing workforce to encourage their use of NHS jobs. There's still a few more things they can do on NHS jobs which would make the process leaner for us. Do some surveys with candidates, hiring manager and team survey, and our team as well. And then finally, allocations. There's still quite a lot of work to do with allocations. It's something we haven't really started on yet, but it is something we know we need to tackle next as well. And that should be the end of the presentation, I believe.
I think it is the end of the presentation. Okay, do you mind if we unshare the screen so that we can see people's faces? Is that okay?
Yeah, that's absolutely fine.
Brilliant. Two really good presentations there. So I'm going to open up for questions. I've got a couple of my own, as I say, but I'll look out for hands up. Jenny, please.
Well, first of all, just so that 1 day a week, Sally, that's 7 weeks a year. That is, so I love the fact that 1 hour a day, for 1 hour a day, if I've got my maths right, that's 7 weeks a year, which is why your numbers look so impressive. And Ruby and Ash, what I really liked about the work that you've done is the work that you've done in partnership with corporate nursing, because that's been the bit that has, in my view, unblocked and smoothed so much and really managed to get us to a place where we are, those healthcare support worker vacancy gaps, that's the bit that I think has just been massive, really massive, in terms of making sure the organisation's got the resources it needs to try and deliver the best possible care at the minute that we can. I've got a question for both of you, and actually, Ash, you answered it a little bit for me at the end, but just that bit, you've both talked about higher staff engagement. I'm interested to know, Ash, I think you said you're going to run a survey specifically, and I guess, Sally, I was interested to know how you were just going to measure that.
I've kind of measured it in that we did the staff stress questionnaire. We did it last year, and the responses we got were really quite shocking, and then we've done it again since Andrew started, or I've just named a name, but since he started working Monday to Friday, and I think that's kind of more measuring the change management that we're doing with him as well. But the responses we got, and then in team meetings I said, right, well, what's ailing you, like what's annoying you, and there's nothing. They come back with nothing. I'm like, hang on a minute, you used to be the grumpiest team on the planet and now they're happy. So yeah, it is good.
Nice. And nice that you used that stress questionnaire, actually, Sally. That's probably the first time I've heard that, so thank you for that. I think that's really helpful. Ash, did you want to say a little bit more about how we're going to measure it?
So, yeah, I think, well, we explored a few things and we don't have anything concrete just yet. Like I said, it was one of the next steps, but we were wanting to maybe do surveys with candidates, but then we thought there's not going to be really much benefit there because we didn't do surveys with candidates before we made the changes. So actually there's not really anything concrete to compare to. So I think one of the most, the initial survey would potentially be with hiring managers because they would have had oversight of both processes. So they will have some idea as to whether the process has been smoother for them. So that would probably be the first step. And then we can maybe do some surveys with candidates now. And as we continue to make improvements, we could then explore doing them further down the line. And at least we'd have something to compare to there.
I think that's a really good point, Ashley, because it's when somebody's actually is told that they've got a job with an organisation, they want, frequently they just want to start, don't they? They want to get in, they want to, you know, and the people that know they're coming, they want them to get in as well. So there is about how you enter an organisation well, and that it's almost like the first point of experience, isn't it, in terms of joining an organisation. So getting that bit right is so really, really important, so that it doesn't feel, so it feels like we're an efficient, productive, engaging organisation right from the get-go. It's a little bit, it's equivalent really to patients' experience of outpatients. We need that to be as strong as it possibly can, because it's the first experience, and it's the same with your service, I would say. It's really, really important for us, definitely. I've got a question for Sally. It might be for both actually, but certainly for Sally. So I remember when we first started out on Leeds Improvement Method, and Joe Cohen, who at the time was the staff side lead, came to a lot of the training and things like that, because they were really worried that people would think it's like a clipboard exercise, or, you know, a time management type exercise. Which we were very clear it wasn't about that. It was more about, it was definitely about making ourselves leaner and more efficient, and better place for our people to work. Did you feel, or did your staff feel, especially when you were sort of like you were marking down it's an hour for this or half an hour for that, etc., did you get any of that pushback at all, or and if you did, how did you manage that?
Not really, because I didn't really tell them why I didn't really say it was for my Leeds Improvement Method. We tied it all in with the change management of the team leader working Monday to Friday, and kind of tied it in with his development of knowing and understanding what his team are doing, and for us to as well understand what they're doing, because they're out on wards here, there and everywhere. And until we went with them, and they used to complain that they didn't have time for a lunch break, but I went round with them, and we went to Greg's and sat on a bench and had a sandwich, which is perfect and fine. But when they used to come back and say that they didn't have time, but they just got involved with it. And I think the fact that myself and my I guess she's my assistant, we sat down with the team and we got them involved and asked them about it. They felt really like we were listening to them, and I don't think they've had that before really. So yeah, I guess.
Yeah, it's really great, Sally. So if people feel as though they've got some control over their work, it's one of the things that comes through the staff survey, isn't it, Jenny? People feeling as though they've got some level of control over the work that they're doing. It's really important, really important. And then my question for, I don't know if it would be Ashley or Ruby really, but you spoke about the doing the 7 S's. I remember, is it 7 S's or 5 S's, or am I getting my commitments mixed up?
7 waste, yeah.
Waste. Sorry, my waste. My commitments mixed up with my wastes. When you were doing that, so I remember right back at the beginning of Leeds when we were doing this. One of the people that worked with us from Seattle said that if they had their time again, they would 5S everything. That they would just literally go through, because there's a lot of waste that's identified either in motion or, you know, all of those different overproduction, etc. So now you did your 5S of your service. Is there a plan to go back and do that again and pick up a different one that you're going to work on, or what's the plan for your team?
I think we'd more just thought about the surveys really that Ash mentioned before, but it's definitely potentially something we could go back and review. Like we said, there's always further room for improvement. So
I think we've just specifically looked at our one sub team, but I know that we are going to sort of go through all the resourcing sub teams. It's going to be a real department wide process. I think we potentially started with the hub team just because we knew those blockers were there with corporate nursing, and there was quite a lot of improvement to be made sort of in an immediate term. So there's definitely a plan to sort of for the same process to be replicated across all of our sub teams.
Yeah, I think it's really important, because, you know, these are really busy jobs that everybody's got, and, you know, and we have to get on the work with the work, but we always need stuff that, you know, the good stuff. So, and what you've said about the empowerment of the teams and those sorts of things is really, really important. And we have to create the space for that, because otherwise we're on a treadmill. And I think it's really, I think going through the teams and being able to get the benefit of what you've described for that hub team throughout your whole team, what a difference it would fit, you know, it would feel like for those individuals working in that. So, yeah, really excellent. Is there any other questions for either of the groups? No, anything from Jimmy, anything from you that you want to add? So I put you on the spot there. Oh, you're on mute again. You unmuted and then unmuted yourself. Don't touch it. No.
Got it. Yes. Yeah. I love these sessions, because it's just heartwarming to hear how people have grabbed a bit of the method, really thought about how it can help them, their teams, and then delivered such great work. So I guess for me that it's more of a well done, thank you, tell other people, share it. It's brilliant, and different angles that we've heard here as well. And Claire, your point's really pertinent in terms of the potential threat of looking at people's work in this kind of detail and saying, you know, we're going to come and watch what you're doing, and our responsibility as leaders to frame that in the right way. We want to reduce the burden of work, take the waste out, so you can spend time adding value to your team, for your patients, your customers. Thinking about how Ash has really thoughtfully thought, well, who are we serving here? Yeah, nursing team might be our customers in one aspect, but we've also got our candidates who are potential colleagues of the future that are our customers. So some really good themes emerging that link with different aspects of the method. And I guess I'd be rude not to say, or wrong not to say, how versatile it is. Look at how we can apply it in different ways to deliver great stuff, even though we're in very contrasting roles in the organisation. So a thanks from me. Get more of your teams on the training. Look what it does. Thanks a lot.
Thank you. It's a little advert from Jimmy there. Absolutely, that's right. I think that's, if there's no other questions, I'm going to bring us to an end. But Magnus, I'm going to put you on the spot just before we go, because I think, Magnus, is this your first report out? This is Magnus, our new CMO. So probably hasn't seen one of these before, I don't think. Magnus, have you?
I briefly came last week.
Did you?
Slightly concerned you're going to ask me a really difficult question now.
I'm not. I'm just, other than what did you think is what I was going to ask.
So I missed the first bit. I was on a call, but I think the whole improvement methodology that's employed here, in my previous roles, I would have snapped your hands off to be able to get this many people to a report out on a Friday. So for everybody on the call, don't underestimate how well engaged and well understood the Leeds improvement methodology is here. And we tried in my previous organisation and got nothing like this. So, you know, well done to all, and I'm very happy to be a tiny part of it at the moment.
Thank you. But I think that's a really valuable point as well, in as much as even if you're not presenting, come back and join next week, because you will learn from other presenters. You know, I've learned from Sally today, from Ruby, from Ashley. So, you know, come back because every single week there's different types of presentations, and it just sparks that little thought about how you could deploy the methodology within your own areas. So 1 minute to go. So I'm going to let everybody go, and thank you very much, everyone, and have a nice weekend. Take care. Bye.